All right, welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director for the International Cardio-Oncology Society. And this is our official podcast where we have the privilege of meeting and interacting with leaders in the field of cardio-oncology from around the world. And today it's our pleasure to welcome Dr. Teresa Lopez-Fernandez to the program. Teresa is a non-invasive cardiologist serving in the cardio-oncology unit and the cardiac imaging unit at La Paz University Hospital in Madrid, Spain. And she's also the president of ICOS Spain. So welcome, Teresa, and correct me if I missed any of your titles there.
No, everything is okay. Thank you, Steve, for the opportunity to be here with you.
Great. Yeah, it's great to have you. And Teresa is also on our board of directors. And one of the things that I enjoy hearing as I interview people for this program is just a little bit about your personal history with cardio-oncology. So just tell us briefly kind of how your interest in this area developed and how you got involved.
So we started with the cardio-oncology program at La Paz Hospital 10 years ago. And we originally built a local registry in order to understand what happened with a cancer patient who developed cardiovascular problems. And we started to build a national network through the CardioTox registry. And through these national networks, we get in contact with different Spanish groups that are also interested in cardio-oncology. And we finally organized a national working group with the Spanish Society of Cardiology and the Spanish Societies of Medical Oncology, Radiation Oncology, and Hematology to try to consolidate a cardio-oncology network in Spain. And in fact, in 2015, we published with some ICOS members the first cardio-oncology book with the Spanish Society of Cardiology.
Wonderful. And was that a resource published in Spanish or in English?
In English.
Oh, okay,
and
good.
I'm going to send you a copy.
Oh, good. I would love that. Yes. I think one of the things that we are seeing a need for as an organization is translating materials into various languages. So Spanish is on the top of the list, given the work in Brazil and South America, Mexico now, Spain. So it's wonderful.
So happy to collaborate in all these tasks, of course.
Yeah. Well, obviously this year we are having a conference that'll be a little bit different. Historically, we've had what we call our Global Cardio-Oncology Summit, the VCOS conference, which I know you've been involved in as a participant over the years. And then this year, for obvious reasons, we are having a virtual meeting. So tell us maybe just a little bit about your experience with VCOS and then how the meeting this year has come about.
So the first time I attended VCOS meeting was in 2015 in Nashville, and I get impressed because VCOS meeting is not a standard meeting. When we attend this meeting, we have the opportunity to meet not only cardiologists, that is the most common for us in Spain, but also oncologists and hematologists. So it's a really multidisciplinary meeting. And we are able to learn latest advances in oncology, in hematology, in radiation oncology, in cardiology, and through different perspectives. We really are able to understand why we need multidisciplinary teams in daily practice, because if we try to organize the cardiovascular care of cancer patients from our own clinic without building this multidisciplinary structure is very difficult, and in fact is not effective to improve cancer patients' health. And so I was involved for the first time in 2015 in Nashville, and I also attended the next cardio-oncology meetings. But this year, because it was also affected by the COVID-19 pandemic, and I have had the opportunity to be part of this VCOS 2020 advisory committee. And after carefully considering, we decided to postpone the meeting to 2021. So at the same time, in Spain, we organize a yearly cardio-oncology meeting that is called Cardio Talks, and is an educational initiative linked to the Cardio Talks registry. And because we also need to postpone the Cardio Talks meeting, we decided to join forces and to turn this year the Cardio-Oncology meeting as a virtual initiative. And well, that's why we started a few months ago to organize the virtual Cardio-Oncology Summit, that is going to be held in October 1st as a joint initiative of the Spanish Society of Cardiology and the International Cardio-Oncology Society.
Right, so we've gone from GCOS to VCOS 2020. Yeah. And for obvious reasons. Yeah.
It was quite difficult to find the correct name for this virtual initiative. And in fact, we have hundreds of mails trying to discover what could be the best way for this new virtual cardio-oncology initiative. And finally, we decided to go to the simplest one and try to impact.
Yeah, I think it's perfect. Well, let's start with just the basics of the conference. Tell us, you mentioned it's October 1st. Is it just a one-day meeting?
Yes, in fact, it's a one-day meeting. It's a short meeting, 7 hours meeting, because we know that nowadays there is a lot of virtual meetings, and we really want to focus the attention on short talks in order to be able to open a live debate with the audience. So we don't want to review all the cardio-oncology field. We want just to focus on the main advances that we have from the last month in oncology, in hematology, in cardiology, in cardio-oncology, and to really have very dynamic and interactive sessions with the audience. So that's why we decided to concentrate the program in a 7-hour program. In fact, we divide the program in 7 sessions. Each session has 50 minutes, and probably more than half of the time is going to be spent in the discussion with the audience and with the faculties in order to really get personal advices in different areas that are quite complex in daily practice.
Oh, that's excellent. So it will be a live event. It's not going to just be recorded. Will it be recorded though and available in the future?
Yeah, the event is going to be recorded, so people who is registered in the event is able to access to all the educational content for 1 year. So it's quite difficult as an international event to schedule the event in the best time for everybody around the world.
Yes.
So probably there are some people that are really unable to attend the live event.
Sure.
But well, most of our speakers are from US, Canada, and Europe. So we try to organize the meeting in the best time for all our speakers and most of our audience.
Right. Well, then tell us a little bit about the faculty and some of the highlights that you think are coming in the conference.
So one of the main advantages of this virtual meeting is that we are really able to gather the best of the best of the best of the best of the leaders in cardio-oncology at the same time. I think that is very complex when we plan a live meeting that in standard conditions. So we have key leaders from US, from Canada, and from Europe in the field of cardio-oncology. We have cardiologists, oncologists, radiation oncologists, and hematologists. We have the chance to get the endorsement of all the Spanish oncology societies and also the Argentina Cardio-Oncology Society, which is really important for us because it demonstrates that the program has a really good quality to be endorsed for other scientific societies. And well, the topics we select for the program, we started with the first session was focused on how to organize a cardio-oncology service. This is not a standard talk. It's just a discussion planning, it's a discussion panel with oncologists, cardiologists, and radiation oncologists also. And our interesting session is the last one that is focused probably in the main reason to organize the VCOS meeting, that is how to organize cardio-oncology during the COVID pandemic, how to improve during the COVID pandemic or during any pandemic the cardiovascular care of cancer patients.
That's wonderful. So it sounds like the focus is kind of very practical, clinical emphasis, and I know too that there will be some discussion about kind of the latest research and things like that. So it's a combination of both. Is that fair to say?
Yes, that's right. We try to combine information, the latest information of clinical trials with the opinion of our key leaders. And in fact, you can review all the information about the speakers on the website because we post some short bios in order to the audience can review which is the main interest of different speakers or what is their main focus in research and in clinical activities.
Great. And, you know, I think one of the things that I've noticed as I've interacted with our leaders around the world is they are always asking those really fundamental questions. We're starting a clinic. What should we do first? So I think that's going to be super helpful. And I think meetings like this, they often don't answer every question that we have, right? But they point us to what are the questions we should be asking, and then they help us with finding where are the resources that I can go to in the future.
We also are going to have the other educational resources during the VCOS conference because we plan 2 satellite symposiums that are based on clinical cases, just clinical cases, no theory, just clinical cases, in order to demonstrate how to use different imaging techniques during the cancer process. As you know, imaging plays a critical role in cardio-oncology from the diagnosis and the prognosis point of view, and sometimes it's not easy to select the best technique to monitor an individual patient, and it's very, very important also to learn how to use these imaging techniques in different clinical scenarios, because probably the objective is not the same before cancer therapy or in long-term survivors or in young patients or in elderly patients. So we are going to try to define all these different clinical scenarios and to concentrate our forces to describe which is the best technique for each individual patient.
So there's two satellite symposia. Are they both on imaging?
Both on imaging. One is focused
Okay.
on echocardiography, and the other one is focused on the MyoStrain on cardiac MRI. So there are two complementary techniques. Of course, we need to use the one we have more experience in our center, but probably it's very important that even if we don't have a technique in our center, we try to understand what are the main interests in having it in order to decide in which moment is the best moment to send patient to another center or to try to incorporate this technique to our service.
Great. And I know this is a hard question to answer, but are there any presentations other than your own, of course, that you're really looking forward to hearing personally?
Well, I'm very, very interested in hearing Dr. Dinesh Tavendiranathan. You know, he is one of the leaders of the VCOS study. VCOS study is a randomized study that wants to demonstrate that strain is the best strategy to organize the cardioprotection treatment in cancer patients, and hopefully we are going to have the result of the VCOS study ready to present in VCOS. But from now we need to wait.
Yeah, no, that's amazing. I think that will be a highlight. Dinesh is such a wonderful researcher, but also such a good presenter. So that will be a highlight for sure. And I understand that on the Saturday following the conference, there will be also the certification exam, the ICOS certification exam in cardio-oncology being offered. Can you make a comment about that exam and what that is and why that's important?
Well, I have had the opportunity to pass this exam in the first a few months ago.
Yes.
It's not very easy to pass the exam, in fact, but I recommend that everyone that is interested in cardio-oncology try to apply to the exam, because it's a really good way to confirm that you are working on this field. It increase your visibility and increase the quality of the work you are doing every day. Because one of the main, let's say, dangers of cardio-oncology is that when we have a new subspecialty, it seems that is like a fashion specialty. And this isn't true. We need cardio-oncology for our daily practice, but not now because it's a new one. We need that cardio-oncology starts for the long term, and we need to build robust structures in order to achieve our main goal, that is to minimize cardiovascular risk in cancer patients and to improve or to facilitate the cancer treatment. And the certification in cardio-oncology, the ICOS certification in cardio-oncology is the only one available from now. And the exam is organized from an international perspective. So the exam covers not only US cardio-oncology practice, but also reflects what are the main rules for cardio-oncology worldwide.
Great. And one of the things that people always ask when they hear about the exam is if there's a review course available. And we are working on review materials right now that we hope will be published within the next few months. So we'll
Yes,
make
we
that
are going.
available.
We are working in this material. Also, because conference is a great way to review the exam a few hours before the exam, because
Exactly.
probably most of the advances are going to be reviewed, so you are not going to have any problem during the exam if you attend the VCOS conference.
Right. Yes, that's how they're related. Absolutely, for sure. So if you could just give one plug for why you think somebody should attend this conference, what would your encouragement be?
I think that's to attend this conference. That you the opportunity to gain a better understanding of the complexity of cardio-oncology and to update strategies aimed to optimize your patient cardiovascular monitoring and at the end your cancer patient prognosis. So I think that is really interesting initiative because you are going to have the opportunity to meet international leaders in cardio-oncology that are going to resolve all your daily tricky question in this field. And in addition, this is a really dynamic program. So I'm sure that you are not going to be upset with the talks, and probably you are going to need to review twice or three times the session in order to be able to learn all the content that we are going to summarize in each session.
Yeah, well, that's wonderful. And so those who attend the conference will have access to the recordings free of charge, correct?
Yeah,
Okay,
correct.
good. And then just finally, how can somebody register? Where do they go to register for the conference?
So this is the very easy. We have built a website, VCOS2020.org, and you can register directly on the website. We have different registration fees if you are a trainee, an allied health professional, a medical oncologist, or a cardiologist, and also we have a discount for ICOS members, and we also offer 50 scholarship to people who has some problems to pay the registration fee. But we need to receive this application for a scholarship before September 1st, because if not, we are not going to be able to review them. So probably one of the best advice is to go to the web and to take a look of the program, of the speakers, on how to register. If you have any doubt, you can contact directly with us through the website, and we hope that you enjoy the conference.
That's wonderful. Thank you so much. It sounds like it's going to be a wonderful opportunity to hear from leaders in the field and also to get a real sense for what's going on in the community of cardio-oncology globally, and then what are the most important issues facing us as we go forward in our practice this year. So thanks for your time, Teresa. And a reminder, it's VCOS, VCOS 2020, all one line, .org, VCOS2020.org for registration. Thank you so much for your time.
Thank you, Steve. Bye.
If any of our listeners would like more information about cardio-oncology or ICOS, you can go to our website, which is ic-os.org, and there you'll find a number of helpful resources.